So my journey into working with Roswell and patient advocacy and doing the work that I do now basically started in 2019. My husband, Michael, was diagnosed with glioblastoma at 44 years old in August of 2019. That pretty much sent us down the path of brain cancer, which not many people know about. When you think of cancer, you think of breast cancer, lung cancer, prostate, kind of your big five. Brain cancer is one of those lurking in the wings. It's out there, and there are a lot of people diagnosed, a lot of people that are under the age of 55. It's also not curable and one of the hardest to treat. When he was diagnosed, he had surgery right away. We immediately started treatment at Roswell Park, along with our team at UBNS and Buffalo General. And Dent was part of our original care team. Being 44 years old, I at the time was 43, I think, 42 or 43. We were just getting started with a journey into creating a family, and we lost some babies along the way. We lost an adoption due to the process of him being diagnosed with such an incurable cancer. So he made it start to finish about 14 months. His brain cancer was considered glioblastoma, stage 4. There were no signs or symptoms when he was first diagnosed. It was a bit of anxiety, brain fog, and feeling really almost like he was having an out-of-body experience. That was really all that presented that sent us to the ER. He started having trouble writing certain letters right before the brain cancer was found. But other than that, there was nothing leading up to the stage 4, and that's what makes brain cancer so difficult to diagnose. You can't catch it in stage 1 or 2. Usually it doesn't present until it's already at a stage 4, and that's when you start to see symptoms. You can't get a proactive MRI or a proactive CAT scan right now. Insurance doesn't cover it. So to be preventative, like you can with other cancers, is just not the case with brain cancer. And so by the time you actually notice that something's wrong, and for some people it's losing the feeling in their arm, it's slurring or starting to lose their speech, it's having a massive seizure out of nowhere, forgetting how to write or forgetting how to say certain words. Sometimes those are presenting symptoms, but again, by the time you see any of that, you're already at a stage 4. So by the time he presented with even the mildest of symptoms, he was at a stage 4. He had surgery within 3 days. We started radiation within 2 weeks, and chemotherapy right after that, which is standard protocol for brain cancer. There have not been a lot of new treatment options in over 30 years. And we are only now in 2023 just starting to see a surge of new treatment options and potentially vaccines and other clinical trials that could really push the longevity for patients with brain cancer. Unfortunately, in my husband's case, in August of 2020, basically a year to the day that he was diagnosed, he started losing weight rapidly. He started losing body mass. He was having multiple seizures, one on top of the other. We couldn't figure out exactly what was going on at first. Originally, his oncologist thought it was just anxiety from chemotherapy, the regular course of treatment. I wasn't as set on that being what was going on. Being a caregiver, it's really important to be proactive and to advocate for the needs of yourself or your loved one. You can't be afraid of the person sitting across from you or the experience of the doctor or the surgeon. You have to have your own voice. That being said, I took him into Buffalo General. I know the chair of the neuro department there, and I basically said, something else is going on. This is not chemo, it's not anxiety, it's not his meds. And so after a ton of tests, they finally did a spinal tap. which we both agreed to, and found out he had leptomeningeal disease, which is a spread of the brain cancer cells into the cerebral spinal fluid, which is extremely, on top of having a rare cancer that only affects 2 to 5% of the population, he ended up with leptomeningeal spread, which happens in less than 1% of brain cancer patients. It is very rare for it to leave the housing of the brain, and that's what his did. There's nothing that can be done for that at that point. And after 2 months, he was actually here at Roswell starting around the end of August of 2020, and he never left. And on October 29th, he passed away right upstairs on the 7th floor. And he was 45 years old. Being a caregiver, especially to a spouse, let alone if you're a parent, a caregiver of a child, it's really a difficult weight to carry on your shoulders. When somebody is diagnosed with something like brain cancer, any cancer really, it's hard to walk a mile in their shoes because they're the patient and you don't really understand or know what's going on inside their head, what their fears are. All you can do is walk alongside of them. With brain cancer, it's really difficult because it's the brain, it's the black box of the body. And so depending on where the tumor is located, you could lose speech, you can lose your capability to communicate depending on where it is or what the surgery entails. You may lose some motor function. So you're navigating very uncharted territory when it comes to dealing with brain cancer itself. Luckily, when Mike was diagnosed, where it was located, they were able to get to most of it, and he was able to keep a lot of his faculties. He did struggle with texting, some simple things. He was an engineer, so very hands-on, very mathematically inclined, smart as a whip, and so normally he would be able to problem solve things very, very quickly. He was unable to do that after the surgery, and so simple tasks all of a sudden that he used to do fell to me to help him do. That was a challenge as a caregiver because, especially when you're the wife, watching your husband all of a sudden ask or need help with things that he used to do to take care of you or to take care of the household, that can be very degrading, and it's a prideful thing. And so I could see the look on his face when all of a sudden he couldn't drive for a while. He needed help pumping gas at the gas station because he couldn't figure out some of the numbers and where the buttons were, all because of the surgery, all because of where the tumor was located. And when you're a caregiver and you're put in that position, you're thrust into a very new environment, a very new situation that there is no script for. There's no map to kind of lead you down a new direction or a new path. When you get married, you kind of have an idea of this is how life is supposed to go, this is where we're headed, these are the bills that have to get paid, we buy a house, you do A, you do B, you do C. When somebody in your immediate orbit is all of a sudden diagnosed with cancer, an incurable cancer to boot, there is no avenue of direction, and there are not a lot of resources to help you navigate that. So what I found to be helpful for me was to do a lot of the research myself. I wanted to take that off his plate. I wanted to kind of disseminate a lot of the clinical trials, what we knew about brain cancer, alternative therapies that were available. And because of the work that I do, I had at least enough skill in my background to ask the questions I needed to ask, to reach out to certain people. What I learned along the way in being his advocate and being his caregiver was that you can't be afraid to have a voice. And I think a lot of caregivers, that is their fear, is that the doctor is the expert, the oncologist is the expert, they know best. They may know best when it comes to the disease in general, but they're also seeing hundreds of patients a day. You're the expert when it comes to yourself or your loved one. You know best. They don't. And so if something seems off to you, if you know that they're reacting to something that they wouldn't normally react to, a medication, if you have questions, you need to be able to speak up and not be afraid to speak up. And if you have the right people on your team, they're going to allow you to speak up, and they're going to want you to do the research and to push them to look for alternatives and other options. I always tell people that, and Mike and I approached it the same way, when we were putting and assembling our team together, you're interviewing them, not the other way around. So you're assembling your surgeon, your oncologist, your radiologist. It doesn't matter who they refer you to, because that's just the norm for them. That makes their lives easier because they have a pretty strenuous job. But it's your job to make sure that that's the right fit for you. And if it's not, it's okay to say, no, we found this other person, we really want them to do this piece, or we want this radiologist, or you're going to do the surgery, we know you partner with them, but we're going to go over here, we want this oncologist. And there's not much that they can do. They can't say no. So you can rely on their expertise, but you also have to trust your instinct and your gut, and that's kind of how we approached it. I always made sure that my husband had a voice of his own, and I think that's extremely important as a caregiver, because sometimes the patient gets lost in the diagnosis, they get lost in the treatment, they get lost in how they're feeling, and so making sure that they feel like they have a voice in the decision making, in their care, in the direction that they want to go, it gives them strength internally when they may be feeling really hopeless. And giving them a piece of normalcy, taking those vacations you want to take regardless of the treatment plan, doing the things that bring you comfort and joy and make you smile are all really important, especially if you're the partner, if you're a spouse, and constantly communicating with each other. Anytime I did research, I never took a step without talking to him and saying, hey, babe, this is what I found, this is what I'm reading, this is what the statistics show, what do you think? Where's your comfort level with this? Should we ask about this? Should we do this alternative? And he was part of every meeting, he was part of every interview. But it also is very lonely. It's a very lonely road. So the patient has their journey and the caregiver has theirs. And even though you're walking alongside of each other, it's different than even when you're a parent. Your paths merge as a family. When you get married, you become one. When you become a parent, you become a unit, a family. When all of a sudden you've got somebody that's got cancer, the paths diverge a little bit because nobody is going to be able to understand what the patient is going through themselves. Nobody's going to be able to understand what the caregiver is going through. So you all of a sudden are on a parallel journey. You're still together, you're still in the fight, and you're doing this, but all of a sudden your paths are not as in sync as they once were. And trying to understand that and trying not to feel lonely within that can be really difficult, especially as a caregiver. There were many times that I didn't want him to see how scared I was, and I would walk into another room and I would just completely lose it. And then I'd throw cold water on my face, toughen up, turn around, go back out, and support him and be there for him. And that was my own personal choice, but he had always been somebody that wanted to take care of me first and foremost, and always wanted to be that person for me. And I knew that he was scared about how I was feeling, and I didn't want him to be scared while he was in this fight of his life. And that can be a heavy burden, and so we each had counseling. I mean, we went together, we went separately, but we made sure that that was a part of that process for us. I think it's a testament to the relationship we had. I mean, we were together for 20 years, and when you love somebody, truly, truly love somebody, you figure it out. No matter what the journey is that you're on, you figure it out. You communicate, you walk together. Even if you're not always walking in sync, you walk side by side. And I think that was vital for us. It was a testament to the type of relationship we had, that we were able to stay in the fight together and always communicate and be in sync, like step to step, even if we were on different journeys of the process. So Survax-M is a vaccine in phase 2B clinical trials right now at Roswell Park through Roswell and Mimivax. They were starting their phase 1 clinical trial when Mike was diagnosed, and we missed it by 3 days. And so we weren't able to get in. We had asked about it when we found out about it, and we had just missed it. So we were trying to look for other avenues and other options. When Mike got worse, because he became the poster child, in all honesty, for brain cancer care, because he was doing so unbelievably well. The tumor had shrunk, and then there was no evidence for roughly 6 months, and that's unheard of. And so everybody across the board was just ecstatic. Everybody thought, okay, we're on to something within the treatment. We found a sweet spot here. When he started to spiral down, we had one of our team members, one of our expert doctors, that really had some pushback, because they really thought that this was just anxiety, and they were throwing anxiety meds at it, the kitchen sink of medications. And my gut was just telling me there's something else going on. And when he was finally diagnosed with leptomeningeal, they called me at 9:30 at night and apologized and said, you know, it just wasn't on our radar. We wouldn't have, because it's just so rare that this happens. The problem is that it's a rare cancer to begin with. We're already in uncharted territory, so you have to know all of your options. You have to know every piece of information, no matter how rare it is or how unexpected or unlikely it could be, because you never know what's going to happen. And had we known about leptomeningeal spread when he was first diagnosed, I would have done more to kind of help maybe mitigate the potential for that to get into the cerebrospinal fluid. And you can't control things, and there's some things that we probably couldn't have done, but there were some devices and things that I found out about after the fact that I wish I'd known about sooner. And that is, you get, unfortunately that's what happens when you're working with a team of care experts, and they are the experts in their field. They do know what they're doing. You have to be able to trust them, but they also have to trust you. It's a meeting of the minds in the middle, and that's what being a team is all about. It's not one person over the other, it's collaboration, it's communication, it's meeting in the middle and working together. And when it comes to your cancer care team, that is vital beyond anything else, that you have people that you're surrounding yourself with, the patient with, the caregiver with, that will work with you as your teammate. And they have experience in certain areas. Maybe you've gotten expertise in certain areas, or you've done research, you have questions. You have to be able to meet in the middle. And when it doesn't happen, there were a couple of times where I started to look for alternative options for other team members, people outside of this area. And we had one doctor that was not thrilled with that. But we did have one doctor here at Roswell, when he was diagnosed with the leptomeningeal spread. He was amazing. He's actually our age. And so this really hit home with him. And we had become so acquainted with the team at Roswell. They became kind of a family for us. And I said, I'm talking to another cancer center down in Pittsburgh, and they are experts in brain cancer. And there might be something we can do with the leptomeningeal just to slow the spread, to give us time to figure something out. And he said, do what you gotta do. I'll send all the lab stuff over. He and I can work together. We can partner. I'll talk to him on the phone. I'll do whatever I have to do. And that is what you want, that collaboration, that willingness to think outside the box, to work across teams, across other facilities, other hospitals, that is key in a well-functioning team when it comes to the cancer care for your loved one. A lot of the doctors, a lot of the surgeons, the oncologists that are on the front lines, especially with brain cancer, cancer in general, but especially with brain cancer, they are literally in this fight with us. They are in the trenches to figure this out because they understand that there's a ticking time bomb when it comes to brain cancer, and that we need to find a cure, we need to find better treatments, and so they are fighting so hard to work with us, and they're spread thin. I mean, anybody in any job is going to get stressed out. You know, you're stretched so thin, and you have so many patients that you have to work with and so many families you have to deal with, so of course they're not going to have all the answers, they're not going to know everything, and so it's okay for you to help them do their job. You know, and if you've got the right people on your team, they're going to welcome that, because they're going to realize that. And I remember specifically this one time, there was a medicine that they wanted to, one of our team doctors wanted to dispense. And I had some questions regarding it because I knew what the medication was. I had some concerns. And the nurse actually whispered to me, don't ask the doctor, because they know what the meds are. They don't understand interactions of the meds. They just know that this is what needs to get doled out. These are standard of care. She's like, if you want the inside scoop, you go to the pharmacist. Yeah. The pharmacists know and even to this day, anytime I have to take something, I don't call my doctor. I call the pharmacist and I'm like, hey, I've got to take this, but I'm also taking this right now. Is that okay? Yeah. And they know, because that's their job. And that's all they focus on. And so it's information like that wealth of knowledge that really only comes with being in it and being in the experience. And if that's something that I can give to somebody else to help them hedge their bets ahead of time without having to do the legwork that I had to do, then that's what I want to do. But it's important that, you know, you're able to meet in the middle, because doctors, I know that they would love to have all the answers, but none of us have all the answers. I mean, we're human beings, you know, so, yeah. In walking this journey of cancer care, of brain cancer, I realized that I had a voice and a platform that I could use to help others to navigate and advocate and build a roadmap for them so that they didn't have to do it all on their own. A lot of times as a caregiver, you're just so overwhelmed with just the day-to-day that to do the extra legwork to figure out what other options are there, especially if you have kids or it's your kid that's sick, it's too much. And so I wanted to eliminate some of that and build a bridge of communication between what the doctors are doing, what clinical researchers are doing, and patient and caregiver stories to tell others what they go through and what their experience is. And that culminated in a podcast that I started called On Glio, which is, and Glio is short for glioblastoma. It was mine and Mike's motto. It was Game On, we're going to take this head on, and so that became the name of the show. And now we're in our third season, and we've become the #2 podcast for health and wellness in the nation to bridge that gap. And it's all about storytelling, and it's using media as a platform to tell stories of those on the front lines, of the patients, of the caregivers, so that they don't have to do that legwork. And that in turn also culminated in my doing some work with different hospitals around the area to get their messaging out about the work they are doing in cancer care, fundraising. We have Traphagen's Trail Ride for Brain Cancer that we hold every year, which benefits Survax-M and a couple of other foundations. And I do patient advocacy work now, where I work directly with patient families. I give them the principal investigators. I get the staff of the clinical trials. I give them anything new that's come up so that they don't have to do that work themselves. And then I put them directly in touch with the people they need to see so that they don't need to look up 1-800 numbers or clinical trials, or go to the clinicaltrials.gov site, which can be really scary to navigate. So it put me on a path that I wasn't originally on, but it's a path that I truly love and enjoy, and I think it's a path that Mike would be really proud of, and probably not surprised that I kind of took the ball and ran with it after he passed. But I don't want his death to be in vain, and I don't want those others that are going through a cancer journey I want them to know that they're not alone, and that it is extremely scary when you hear that C word. And it is an enormous undertaking, but there are so many people in your corner and so many people that are in this fight with you that you're never truly alone walking this path, no matter how siloed it may feel at times. And there are so many unbelievable resources and advocates and people that care, and it's a matter of keeping all of those resources close to you and pulling at every thread that you can. And if I can contribute to that in any way, that's my journey now. That's my goal in life, is to do that. It's amazing you meet, the people you meet along the way doing this kind of work, but it's so important to empower people. And even with doing the podcast and having patients come on and tell their stories, the whole purpose of that was to give them a voice so that they feel empowered to share their journey and what they're going through and how it feels. And then if something does happen, it lives forever and ever and ever, and their story will forever resonate and be told. So it's kind
of like this program.
Yeah, a little bit. Yeah, just as a podcast, and it's storytelling. But there's so much to learn from the journey, and if there's anything I can give to caregivers, it's for as much as we lost. I mean, you look at the fact that I lost my husband, our children, our adoption. I actually just lost a friend to cancer. She was 33, right here at Roswell. Our dog passed away shortly after my husband did, and yet I'm here. I'm still standing, I'm smiling, I'm strong, and I'm finding purpose in all of those losses, in losing my best friend in the entire world. I'm finding purpose in that, and if that can tell anybody anything, it's that no matter who you are, no matter where you live or how much you do know or what little you know, you have the strength to navigate all of this cancer journey. There is not a person out there that doesn't have the strength to walk that journey, and I'm a living example of how resilient you can be in the face of significant trauma.